Welcome to the Sniff Spotlight Series, your one-stop shop to find out what's really going on in sniffs nationwide. I'm your host, Yitz Rubin, and this is sponsored by Renewal Rehab, the best therapy provider for sniffs nationwide. So, Kerrie, you've been here with Renewal for 4 years now. So, can you take us back to the beginning of when you started?
So before I started with Renewal Rehab, I was working as a director of rehab. What I was doing was I was helping out my regional. At the time, she kind of took me under her wing and had me help her oversee some of her sites. So I would kind of go in and fill in for her and help out with like maternity leaves, and if other directors needed help just with managing their sites, she would have me go in there and help out those directors and those buildings. And she really taught me a lot in terms of, how things worked in the buildings, how she did things, and it really helped me become a regional.
Right.
She was very instrumental into, kind of guiding me through my career and really showing me, this is something that I could potentially do, and I might be good at this, that I could really branch out and expand, my career. When I saw that Renewal Rehab had an opportunity to be a regional, is when I, applied for the position and was lucky enough to get the position. So that's when I started with Renewal 4 years ago.
Right.
And I have absolutely loved working for the company since then. And I really grew and kind of found myself as to what kind of regional I wanted to be, and I've really found my own, and I love what I do, and I love working for Renewal, and find that they're the most supportive company I've ever worked for.
Wow.
Yeah.
That's very impressive, because I came into the company pretty recently.
Mm-hmm.
I'm there only 4 months. And I find that it's a very good culture. I didn't have the opportunity to meet everybody in the field yet,
Right.
because of COVID and things. But I find that people really like each other, and
Yeah.
it has that warmth. In the corporate office, we have a lot of fun.
Mm-hmm.
We started doing videos together. I'm not sure if you saw any
I
of those.
did. Yes. Yes.
So those are fun. And I hear that you're an amazing, I've heard that you are an amazing regional director. So
that's
whatever,
nice.
yeah. So whatever that, that original mentor, I guess, really did a good job. So.
Yeah, and I think it also helps that I enjoy what I do, and I'm passionate about what I do, and I care a lot about. I want to be successful, and I want my directors and my therapists to be successful. And I've worked a lot with the people that are in the corporate office. I've worked with a lot of the staff, and they've worked with me, so they do know me. But I want to have one of the best regions in Renewal, and I preach that to my directors so that they know my expectation, and I want them to want to be the best as well. So my biggest thing is communicating with my staff, communicating with my therapists, knowing that I'm available to them. So I do feel that I have a great relationship with my teams, and therefore we have great results, and we work really well together.
Yeah, that's what I found with the Renewal Rehab team.
Mm-hmm.
It's they're very good at communicating, the
Yeah.
leadership skills, holding people accountable,
Yes.
and training and working on that. We're actually holding a seminar soon with the crucial conversations
Yes.
leaders.
I'm excited to be a part of that.
Yeah, me too. I'm very excited about that.
Yes, I think we'll learn a lot and how to handle difficult conversations, which I think will be a huge piece for managers.
Yeah.
Because sometimes conversations that you may not want to have that are important to have, it's always nice to learn maybe how to have those a little bit more successfully.
Yeah.
So, but yeah, I mean, I always feel like that's one thing that I love about Renewal is that I'm comfortable going to people in our corporate or from our leadership team. I'm very comfortable going to them with questions and not feeling like I'm going to be judged because maybe I don't have the answer or I don't know, how to respond to something. I know if I go to Lynn or if I go to Safu or if I had to go to Ellie, I know that they wouldn't judge me for not knowing, that they would guide me with confidence and guide me in the right direction without judgment.
Right.
And only with support for the best. So our company, they always say we're like a renewal, is it like a family? And I truly feel that we are a family. We always support one another. We want everybody to just be successful. And I feel that Renewal is a family to me. And,
Right.
and I feel the therapists and the directors feel that way too. A lot of times when I do like performance reviews with my directors, they always say, this is like one of the best companies I've ever worked for. They feel supported. They feel that they're guided in the right direction. And they feel that they work for the best company.
So what was it like for you? What was it like for you entering the nursing home field?
It was a little intimidating at first because I had no experience. When I started off my career, I worked in the hospital setting. So even in my schooling, none of my clinicals were in a skilled nursing facility. I only wanted to work in a hospital setting was kind of my goal in school. So my clinicals were at the hospital. So I had worked in level 1 trauma centers, burn units, worked with ortho patients, trauma patients. That was kind of my thing. So my first job was at Loyola Medical Center. I worked throughout the hospital there, worked every area of that hospital. I worked the rehab unit, everything. So that was where my big chunk of my experience was. I really enjoyed working there. They also kind of had that family unit. A lot of friends I gained working at that hospital. So that's where I gained most of my experience. And then I, from there, worked at the Rehab Institute of Chicago. So that was another kind of step into my career that I wanted to gain a lot of really good experiences in my career. After that, I went into something completely different and worked with kids in the school systems. And that's when I had my daughter, because the schedule was a little bit lighter because you had the school schedule. So I worked with kids a little bit. And then a friend of mine asked me if I wanted to try management in a nursing home. And that's where I got my foot in the door with nursing homes. And I wasn't quite sure because I didn't know anything about Medicare or insurances or anything like that. But I was like, well, why not? I'm not afraid of new opportunities and to try something. So I said, well, I'll give it a try. And so that's where I got my foot in the door with management and working in nursing homes. And that's where I've been ever since. And I really enjoyed it and I loved it. And I really have a heart for geriatrics. I love working with the older populations. Just that conversation with older people and learning about their paths, their past histories. And it's just, they're fun to work with and to hear about what they used to do when they were younger and their families. And
it's amazing probably because there's so much experience and knowledge in that nursing home. So to be able to be with them and where they have tons of time and they're extremely bright people with a ton of experience.
Right.
So it's like getting that information from them, you really have that opportunity.
Oh yeah, and there's so many, even like the nursing home too. Nursing homes are a lot different than what people think nowadays because a lot of times it's rehab to home. So a lot of people just go there for their rehab and they go home. And then you also have the other side of it where this is where people live. So you want to be able to help those patients too who have declines because maybe they don't move around as much as they used to. You know what I mean? So you want to be able to help those patients be able to stay at their level of function or be able to prevent a decline from getting, weaker. So those people you want to be able to work with as well. So you've got two aspects of a facility that you're helping, which is really neat. So it's the best of both worlds, really.
So how'd you learn the ropes, the whole Medicare, Medicaid? There's so many different nuances.
Yeah, it was really when I had worked with that previous regional director, and I got the experience of going to all those different types of nursing homes and going to different Medicare meetings, is when I really learned about Medicare, these different types of insurances, insurance cuts and what they look for, documentation and what they don't look for in documentation, and how they approve, therapy. And there's different types of consultants that come into the Medicare meetings that help educate you as well. And just my experience with going to those meetings at those different sites is where I really learned a lot about Medicare and how things work. Because each facility you go into operates a little bit differently. And just working in different homes is where I really gained a lot of experience.
Right, because it's like there's so many different ways of working, and Medicare is complicated. The whole
and it
billing
changes constantly, too. They're always looking for, different reasons that they may not approve therapy, or, this is what they're looking for to approve therapy, and this is what's not going to be approved anymore for therapy, or now we're into PDPM, and where before we were RUGs based. They're always changing and evolving, and we have to stay on top of it.
Right. It's actually interesting because I've been speaking to many nursing home administrator operators, and they own one or two homes and things like that. So they are, many times they're thinking like, why not go in-house with our therapy? Why use a company like Renewal Rehab? So it's interesting what you're saying is because there's so many nuances and changes and different ways of running things that, like, to have a team that has the information from 100+ facilities like Renewal Rehab, all with excellent communication, all coming back to the same source with the mama and papa, Ellie and Lynn. So like having them have all that information, that could provide tremendous value to an organization, to one, to even someone who has 10 homes, that could really provide serious value.
Right. Yeah, we have a lot of expertise because we have experience in, like you said, over 100 facilities, compared to maybe their 1 or 2 or their 10, So we have this wealth of knowledge, and we have a team that this is what they study and focus on, that can give us this knowledge as well to be able to provide to our homes. So yeah, I think that we offer a great wealth of knowledge and information to our administrators and our owners, in terms of Medicare, or what they're looking for sure.
So you're one of the leaders of Renewal Rehab, managing. You have a team of DORs, which in turn has a team of therapists on the ground. So what would you say makes a great leader? I mean, it seems like you are that great leader. What would you pinpoint to say, hey, this person has those skills?
Communication is huge. And holding people accountable is also big. I think that if you can communicate to your team and hold them accountable, you will have a successful team. It's when you're not able to manage your team and communicate what it is that they need to be able to do and hold them accountable, you're not going to find success, because they don't know what they need to do, and B, you're not holding them accountable for following through the tasks, so nothing's going to get done. So I think those two things are really big. Being approachable to your team. I think some people think that being intimidating is a good way to, be a boss. And I don't think...
I think Rena thinks that.
Yeah, that doesn't work.
She's being tough.
That doesn't work.
Rena, you heard her.
It's not going to work for you.
Cut the...
I want people to know that they can come to me, and that it's going to be okay. You know what I mean?
Rena, you heard that.
And I feel that, people who know me know that they can come to me and you're going to be fine. Some people that don't know me, they might, for some odd reason, feel intimidated. I don't know why, because when you know me, I'm a nice person. But those that reach out to me, a lot of therapists do. They'll reach out to me because they've got a question or they want to know something. they have no problem reaching out to me. So I think that when you know that you're approachable, you can get a lot more done as well.
Right.
So yeah, I think those are some things that make a really great leader.
Right. I also find it very challenging and uncomfortable and not fair always. It's not like a level playing field because, when the chain of command is over here and the person that's lower on the lower spectrum, so it's much more intimidating. It's not a fear thing. So I feel like a leader has to actually be extra humble and
Yeah.
extra easy to work with in order to create a sort of level playing field where then they can expect their colleagues, their peers, and their employees to be able to approach them.
Right, right. Well, and I think, give that person an opportunity to hear them out, you know what I mean? And be able to change whatever it is that your issue is or correct, you know what I mean? Have that conversation. And if still there isn't any change or you can't come to, any kind of conclusion and you can't, you're not getting anywhere, then, you can take those extra steps. But I think that, it's important that you give that person an opportunity before going above somebody. You know what I mean?
Right.
Communication during COVID, I think, has actually been increased because you have to communicate more at this time because you're not on the sites. So I feel like I'm communicating a lot more with people than even before. I'm on the phone all the time with like directors or emailing a lot more too. Just the communications really, really strong. I mean, through these past 9 months compared to maybe before where I was more on site and traveling around. I mean, now I'm more, I'm sitting still. So I'm probably communicating 10 times more than I was even before. Because I'm sitting there, so I'm thinking about, I'm not as mobile. So I think the communication right now is probably 10 times more than it was when I was on the go, because I was more, traveling around and on the go. So I think right now our communication's probably the best that it's ever been. And I feel like I know my staff probably the best too. Now the face-to-face, that part I miss a lot.
Right.
Because you don't see people face-to-face as much. So that interaction I miss.
You're mentioning something that's coming to mind now is like, for example, like when I'm spending time with my wife and we're together the whole day. So then comes nighttime and she's like, hey, we didn't spend any time together. And I'm like, we were together the whole day.
Right.
I don't get it. And
Right.
then it's like, but we didn't actually talk. Like we're just
Yeah.
doing this. So we didn't get to know each other. We didn't get that bonding time. So it
Right.
sounds like it's similar. Like when you're on site, it's
Yeah.
like you just see the person, but you're not going to sit down for a half hour and have that
Right.
face
Right.
to face.
Yeah. Your interactions are a little bit different, when you're speaking to each other versus just sitting next to each other. You're physically there, but you're not interacting,
Right.
So yeah, it's similar with like at home with my children. Like I'm physically there, but I'm working. So I'm not,
Yeah.
necessarily interacting with them,
So what's it like working remotely with your kids there?
It's been well, in the beginning it was a big challenge because we were trying to figure out how to work and then have my kids there. So that was a little overwhelming. But we figured it out. My daughter she's remote learning for school. So she sits next to me and she does her schoolwork and her remote learning. And then I do, my work. And then my parents come and help me with my son, who he stays home as well. He's 5, so he stays home. And my mom is like his preschool teacher. So she's done a very nice job kind of coming up with a preschool curriculum for him and keeps him busy, and my dad does as well. So they come and help me keep him entertained while my daughter and I do our, our work.
Right.
Yeah.
So it's like, and then the kids are asking you like, hey, could we or you're asking them, hey, I think you guys were great today. You guys can watch Home Alone, and they're like,
Right.
no way, we want the Sniff Spotlight series.
Right. Well, my daughter said
You know?
she's going to Google me.
This
Yeah.
Sniff Spotlight
Yeah.
series.
Yeah. Yeah.
Yeah. How did your needs and your team's needs change during COVID?
So COVID, became a big challenge, especially in the beginning when we were all, trying to figure out how to handle it. Trying to balance their concern with COVID and how to handle it, and then how I can help them from a distance was very challenging emotionally, and trying to be a support system to them was tough, especially in the beginning. I didn't know how to help them the way I wanted to, because I couldn't physically go into the buildings because I wasn't considered an essential, staff member. So emotionally, and as a support system to them, we did a lot of Zoom calls for the teams, and just trying to educate them on like PPE and what types of materials that they needed to be wearing, and how to treat patients with COVID, and prioritize COVID patients. There was a lot of educating that needed to be done on how we work through this in the beginning.
Yeah, especially the fear, because a lot of them are in love with their patients.
Oh,
They're
yeah.
in love, like this is like their adopted grandparents.
Sure.
And they're so afraid that, so first of all, their personal life, they're extra cautious, and, just they don't want to get anyone else to get it.
Yeah, your whole kind of the emotional piece, is I think it's kind of having an effect on everybody. And even, it made me think too of the patients or the residents in the nursing homes too, because they're confined to their rooms too. So even the aspect of not only the healthcare workers, but the residents, it's taken an effect on them as well with COVID, because the social and the activities that they were having prior to COVID, those are very restricted, if not gone, because they can't socialize like they were. They're very restricted, and they, a lot of the residents have to stay in their rooms right now. They can't go out of their rooms. They're very isolated. So that whole aspect affects everybody, that psychosocial aspect.
What do you love most about your job?
I love helping people. I want patients to get better. That's my most important thing to me, is that I want my therapy programs to be the best. So anywhere that, we provide therapy, I want us to be the best therapy provider. So I want us to have the best therapy programs, the best therapy outcomes, and I want us to be the best therapists for our patients. So I want the most success for our patients. So I love being a therapist. The other aspect I love is I love what I do. I want to be a great manager, and I want my teams to be successful. So I want to be successful for my company, and I want to be successful in my career. So I'm passionate about what I do. I love helping people, and I want to continue to be successful in anything I do. When I set my mind to something, I usually try to do it.
I would like to thank you on behalf of the Renewal Rehab family for doing such an incredible job, being so passionate about your work. So thank you so much. It's a privilege, and thank you for joining us on the Sniff Spotlight series. Thank you for sharing this tremendously important part of senior care. The Sniff Spotlight series highlights healthcare heroes and thought leaders in the skilled nursing community. We're building awareness, trust, and shining the light on sniffs. So stay tuned. Remember to like, comment, and share. What makes you so emotional? You love your team. Like your team, they're your people. Like it's like, and you're sending them out to work. Like to.
Yeah. I had one therapist, he got really mad at me. He was like yelling at me one day. And he's like, "You're not here. You don't understand." And I was just like, but you don't have any idea how much I think about it, you know? It's like, I may not be there, but it's not like I'm like, oh, whatever, you know, I'm just doing my nails, you know? Like, I'm thinking about you people constantly, and how can I help you, you know? And like,
It's like a mom who sends out their kid to war. It's
yeah,
like, who's it more painful for?
right,
Like the mom is nervous.
yeah,
The
like I wish I could help you and give you the best of the best to protect you, you know? And I don't want you to get COVID, you know?
like for him to think you don't care when you're like, it's like, hello.
Like, you have no idea. I care a lot.
Not everybody cares like that.
I care.
That's
Okay.
awesome. You want to just-
And not only that,
Oh.
right. No, it's probably so good for the team to see that, to like see like, hey, they care. You know, like
Yeah.
they're with us in the trenches. They're not just
Right.
sitting there like, oh, just, you know.
Well, I think sometimes people have I think in all the regionals, I think this, that, you know, we just sit at home and we're not doing anything, you know, and like, we're working all day long. Like, I'm at my computer all day, you know, till 4:30, I finally shut it down. But, and even at night, you know, I'm still going through I respond to my, you know, stuff. And, you know, my day doesn't stop. And people don't realize that because they don't see us. So they don't think that we're working that hard, you know, as hard as we do. So because they don't see us, they don't realize how involved we are from the distance, and how much emotionally we care. And I know what's going on more than they think, you know, that I know. I know what they're doing.
Right.
You know.
It's also like the communication, the leadership. There's a lot about communication, but so it's like communicating what we want done. But like, how do we communicate our feelings of like, hey, we love you. We're in this with you. We're not
Right.
just like on the side.
Right. Like, I want to be the regional. Like, I want to be the boss, their boss. But I'm also a person, and I care about them more than they don't. You know, more than they know. You know, I care about them a lot. You know.